aspirecore. The patented all-in-one bone marrow biopsy system is the latest innovation from Worldwide Medical Technologies. It combines the best features of an I-style aspiration needle and J-style biopsy needle with the advanced core lock system to safely and comfortably capture aspirate and core bone marrow using a single needle through one puncture. Just as significant, the quality and accuracy of the aspirecore samples are not diminished. aspirecore makes it easier on both the physician and the patient without compromising the integrity of the samples. Each aspect of this unique system was designed from the needs of its users. The specially designed fenestrated aspirecore needle with the stylet in place creates a small volume direct path from the side holes along the distal tip of the needle to the syringe, collecting aspirate through these unique side ports so as not to disturb the marrow sample. A patented ergonomic handle allows for increased torque with extra physician comfort and stability, even for smaller hands. The one-piece design assures comfort and control with or without the stylet in position. Our distinctive spade point tip of the cutting stylet enhances mastery of the needle during penetration of the iliac crest. A sharp, symmetric point ensures positive positioning on the crest without slippage, eliminating painful sliding or walking on bone surface. The dual bidirectional cutting surfaces on both the stylet and cannula allow cutting in both directions, ensuring a faster and smoother cut through the hard bone and into the marrow cavity. Special needle coating prevents blood coagulation, thereby providing pristine aspirate samples for truer analysis and evaluation. The core lock system offers these exclusive features: proprietary smooth bore technology that delivers solid uncrushed cores, centimeter markings on the push rod providing verification of sample length prior to extraction, patented core lock cannula surrounding the core to protect it as the cannula closes off at the needle tip for a perfect sample every time. Extraction is through the tip, resulting in less stress and compression. After prepping the patient, gentle pressure is applied and a clockwise counterclockwise oscillation is needed to enable the needle to penetrate the bone cortex. Once the marrow cavity has been reached with the stylet in place, attach the syringe to the hub on the aspirecore handle with a firm push-twist motion. Apply suction by pulling back on the syringe plunger. Once the desired amount of aspirate has been drawn, remove the syringe from a handle and now remove the stylet. Cutting into the marrow is optimized by the dual bidirectional cannula cutting tip. Gentle clockwise, counterclockwise oscillation and light pressure ensures that the core sample will immediately go into the needle bore. Superior cutting edges on the cannula are designed to ensure clean coring of the marrow. Special smooth bore technology in the interior tip of the cannula prevents damage to the sample core as it moves up into the needle. Specimen sample measurement. Verifying presence of marrow in the needle prior to extraction reduces the number of attempts of collecting sufficient marrow for the diagnosis. The centimeter markings on the push rod allow the user the increased confidence of confirming and measuring the quantity of the marrow in the needle prior to extraction. The push rod is to provide you with an approximate reading and to establish the presence of marrow in the cannula prior to extraction. Gently place the rod into the cannula until the top of the specimen is located. Pushing too hard will change the integrity of the specimen sample. The number of 0.5 mm graduations that extend out from the lure opening indicates the length of the specimen within the cannula. Collecting the sample. When the predetermined sample size is confirmed within the J cannula, place the core lock device into the lure opening and gently advance it into the needle with slight oscillation. As the tip of the core lock enters the J needle, taper resistance is felt. Firmly press the core lock extraction cannula cap until it is fully seated to ensure complete encapsulation of the bone marrow sample. The sample core is protected and firmly held while the core lock closes at the distal tip of the needle. Removal. Reducing patient discomfort is foremost in the mind of the user. The core lock extraction cannula eliminates the need for painful rocking and redirection of the needle. Rotate the needle's handle in place 360 degrees with a few quick twists. Do this once or twice to ensure any fibrous tissue has been cut. Grab handle securely and gently rotate out to work the needle out of the bone. Redirecting or rocking the needle is painful and unnecessary for the core lock system to work. Sample specimen collection. Once the needle is removed from the patient, the core lock cannula is pulled out from the aspirecore needle. The core is nested in a protective slot of the core lock cannula and can be expelled out of the distal end by placing the push rod into the opening at the top of the core lock handle and gently pushing until the sample is free. The core lock bone marrow biopsy system is the only system that ensures the ability to quantify and capture a predetermined sample every time. The dramatic benefit of aspirecore is its ability to extract both aspirate and core bone marrow biopsy through a single needle puncture. This not only saves valuable procedural time, but also means less anesthesia and discomfort to patients. Worldwide Medical Technologies continues its standard of product excellence.